Are you struggling with knee pain that just won't go away no matter what you try?
Well, the truth is you may be doing things that are irritating it without even realizing it. We are going to get to the bottom of this. I'm Brad.
I'm Mike, and behind the scenes we got Bob, and together we're the most famous physical therapy team on the internet.
In our opinion, of course.
And if you're new to our channel, please subscribe if you like this video. Anyway, today's topic is knee pain. So we're going to go over 5 different exercises or things that may actually be flaring up your knee and what you should do instead.
And stick around for step number 6 because there is a common exercise that many people do thinking their knee is going to get better, and it actually does the opposite. And we're going to show you a proper exercise that will definitely help your knee as opposed to making it go downhill.
Many therapists actually recommend the exercise we don't.
Right. Well, I know we're ahead of the game.
We're different. Anyway, first tip is unloading the knee when you are walking and standing. And what we mean by that is if you walk without a walker, cane, anything like that, sometimes you start limping and it gets worse and worse. You may need to unload the knee by putting pressure through your arms while walking and see how that feels. Now, if you're just having a little flare up, this can just be temporary, maybe a week or two. But if it's kind of long term, you may have to stick to it until the future. So, Brad, do you want to show how to use a cane?
Yeah, this is one thing I've done many times with patients. They got a left knee pain. I said, take this cane, put it in your right hand, and walk. And they'll do this, and all of a sudden, that grimace that they had with weight bearing goes away. Their knee is much less painful when you unload it through a cane or a walker, and they're happy to use it. Again, I reinforce, this is not a permanent thing often. Unload it until the pain resides, the inflammation goes away, and you can go without the assistive device.
Now, if you're already using a cane and it's still flaring up your knee, maybe a walker is the best route. They have standard walkers, some with 2 wheels, some with 4 wheels. It doesn't matter, whatever you feel comfortable with. But you can see I can really load through my arms and take pressure off of my legs when I'm walking with this. So this can help with your knee pain.
That's right.
What's number 2?
Number 2, walk with soft knees. You probably aren't aware what we're talking about when we say soft knees, so we'll explain it. It's a very simple way to change your walking gait, which takes stress and force off that knee joint.
So when you're walking, typically a lot of people heel strike, their foot goes in front of them yay far. Notice my knee is straight. This can put more pressure on the joints of your body, ankle, knee, and hip. Back as well. So what we want to do is just take a smaller step, either land kind of with a flat foot and bent knee like this, or you can kind of land on just your forefoot, depending upon what you're comfortable doing. Try this at home first without shoes or socks on, because most shoes have built up heels nowadays. I actually have 0 drop shoes, so the front of my foot to the back of the foot is the same height off of the ground, so I don't really have this issue. But just try walking like this, slow little steps, and see how your knee pain feels. If this makes a big difference, try this out. If you don't notice a difference, then I guess it's not going to help you.
Right, but you'll find out if you go barefoot or a very thin sole on a hard surface and you pay attention, when you heel strike, there's a jolt or forces going through that knee that do not need to be doing that. So I think it's a good idea. Let's go to number
3.
Yeah.
So actually we want to strengthen your hips, even though we're talking about the knee. They connect, they're joint to joint. Oftentimes something that happens at the hip can affect the knee and vice versa. So oftentimes people, as we age, maybe become weak in our hips. If you ever notice people that kind of have a waddle walk, typically they'll have a weak hip abductor, the side muscle group here in your hip. So we actually want to strengthen this up. To do this, we can do it many different ways. We're just going to do one option in standing. Brad is showing it there. If you need support, hold on. But you're just going to put a slight bend in your stance leg and kick your other leg straight out to the side. You don't want to teeter-totter and kick up higher. You don't want to rotate your foot out. Just try to perform 10 to 15 reps on one side and then switch. You can certainly do these at a countertop too if you don't feel steady. But if they're easy.
Did you mention that the weight-bearing legs should have a slight bend in the knee?
I did mention that too. I don't think you listened.
What about the toes? Did you mention?
I mentioned the toes too.
Where was I?
But if you want to add resistance, Brad, what can they do?
Well, you can certainly take one of these, a band, the exercise band like this. Very simple to do. You simply keep your shoes on and go like this, and you can work like this. It really makes a big difference. Obviously, you need to have pretty good balance skills. If not, have a cupboard in front and hold on to that, or a chair backrest.
Any type of resistance can work. I have a cuff weight on. If you have a loop band like this, you can put it around your ankles. They all work the same. Just if you happen to have one, use that.
There you go. Now, what are we on, 4 or 5?
Tip number 4 is sleeping with knee pain. So we need to grab some pillows for this one.
Yeah, I'll get some. Don't worry about it. We got them right over here, a whole stack of them. Oh. So we're going to talk pretty much just about between the knees. If you haven't done this and you have knee pain at night while you're sleeping, particularly on your side, you will be very happy to put a pillow between there and experience the difference in pain level. I like doing this even though I don't have sore knees. It's just more comfortable. Puts your hip and back in a more neutral position. It just works out very well.
Yeah, if you look at my leg here, my hip and knee are kind of in a straight line. If you look here, my knee is downward angle, putting more stress on the outside of the hip, outside of the knee. The knees are touching.
Especially if you do that.
Some people start rotating like this, and you really got some pressure on it. So it's just an easier way if you're having knee pain. Try that out.
And if you sleep on your back, 1 or 2 pillows, line them up here and take stress off. And I know, Mike, you mentioned sometimes you'll have people do that, or you do it yourself.
Yeah, just to have a little bend in the knee. Sometimes if people are in bed for a long time and your knees are locked out straight, sometimes that can get tight or painful. So just an option.
Excellent. This next one, the hip flexor. So what do the hip flexors, muscles up here in deep that allow your hip to flex, why does that make a difference, and how do we treat it to support the knee pain?
So with knee pain, obviously the hip muscles control the hip, but we have one that controls the hip and goes down to the knee called the rectus femoris. So sometimes that can get tight on people and cause knee pain. So what we're going to do is a stretch, lay off the edge of your bed if it's firm enough. If you feel like getting on a table that's firm, you certainly can. But you need something so your legs can kind of dangle on the ground.
They'll see.
So when you do this, start with both knees to your chest. If I'm stretching my left one, I just drop it down, feeling a hip flexor stretch. Now when I pull my heel back, I feel it more in my knee and my quads, getting more of a stretch up front here. You want to keep a nice straight line with this, not let it veer out to the side if you're really tight, and just kind of hold this for 30 seconds. Reset, and then you could try it on both sides and just see how it feels. You may notice a difference between the sides, and if you're not getting a lot of stretching or feeling in there, you can certainly kind of dig and rub around and even massage with your hands, or you can take a massage gun like that and put it in there as well. But I don't trust Brad, so I'm gonna do it myself. So when it comes to massaging some of these muscle groups, either in your knee or your hip region, just make sure if you have a firm head, stick to the muscle areas, not a bony area. And you can mess around with if you like to do it in a stretched position like this, or if you'd rather do it standing or seated, just see how it feels. Depending upon the tightness or looseness of the muscle, the massage will feel different.
Tightness or looseness?
Yes.
You need to take, we need an English major here.
That's a perfect phrasing, but yeah, if you just kind of massage in there with a gun, it can kind of help.
Yeah, actually feels good.
Well, should we get on to the bonus tip?
Yeah, this is what everyone's been waiting for, Mike. What exercise have people been doing thinking their knee is going to get better, and actually some therapists? I've been guilty of this myself years ago before I learned more about knee mechanics and what really works for arthritic knees.
So we call this in the therapy world long arc quads. In the gym, they're just called knee extensions. Now, this is a good quad strengthening isolation exercise. If you're young and you don't have knee pain, go ahead and do it if it doesn't bother you. But if you're having knee pain, this can possibly flare it up because it's really close packing or making more pressure in the knee joint, and it can also mess with the kneecap a little bit. So we want to actually avoid this because it could be flaring up your knee pain, and instead we want to strengthen the glutes, which are very important with walking and standing.
Right, so when the glutes put force through that femur. It allows the mechanics of the knee to do better. It actually puts a little external rotation on the femur. I don't want to get in the weeds too much.
Yeah, you're a nerd.
Right.
Anyway, to strengthen this, we often do some sort of glute pump exercise. However, the variation we commonly show is on your knees. And if you have knee pain, you don't want to get on your knees. So, Brad, you want to show the standing variation?
Oh, sure, yes. What we're going to do is go up to a cupboard, firm chair, anything where you can put your hands on about this level here. And now I'm going to work my right gluteus maximus. That's that muscle we're going to really emphasize on by bending the knee approximately 90 degrees. Steady ourselves here, and we're going to start not straight down with the femur or upper leg, but back a little bit, and then we're going to go back like this and forward and not like this. We're not trying to work our trunk motion, isolate that glute by going mid-range, up and down, 10 to 15 repetitions, and you should feel that muscle start to fatigue and burn a little bit. If you want to get a little more emphasis on that muscle, watch what I do with this leg. I rotate it this way, and then I continue to proceed with this same motion, that mid-range, 10 to 15 reps. And yes, I can feel this much better now. Yes.
There.
Make sure you do both sides, though. Even though the other side may not be painful, it's good to keep your body balanced.
So give all those 6 tips a try, see what works for you and what doesn't, and just stick to the ones that seem to help your knee pain out. And if you want to check out more videos on knee pain, click the video link on the screen. This helps you identify what your knee pain may actually be caused from.
Oh, yeah. 10 typical pain spots.
Yeah, so we go through a whole array of different areas that could cause pain in that video.
Right. So now they know the main secret of their knee pain and why it's getting worse, perhaps.
Perhaps.
If they're
Hopefully.
doing this, yeah. One way or another, we're going to continue to provide you with videos on how to be healthy, fit, and
pain-free.
There you go. Adios.
Bob and Brad, the 2 most famous physical therapists on the internet.